Good afternoon, everyone. My name is Bob Porter, and I'm one of the emergency docs at the Janeway Emergency Department. I've been there for about 9 years, and I've also worked in other emergency departments in the province as well. And the Janeway Emergency Department is unique in this province. It's the only emergency department that sees exclusively children, pediatric patients. And because of that, the expectations among the general public and other physicians for the care that we provide is very high, and rightly so. And if you've been to the Janeway, and most people have been there as a parent or as a patient, you'll know that we see a lot of children with fairly minor conditions, non-life-threatening ailments. But what you might not see is that we also see patients with critical illnesses and injuries. And these could be kids with, meningitis, it could be shock, it could be, a shaken baby, it could be anything like that. And it's the care of those children that we'd like to focus on today. Because in looking after those kids, we as emergency physicians don't function in a vacuum. In order to provide the best care possible for these children, we need to have excellent pre-hospital care so that these kids show up in our department in as good condition as possible. And we're very fortunate to have excellent pre-hospital care providers. And then we do our piece. We provide emergency care to these children. And that could mean aggressive use of intravenous fluids. It could mean any of a number of procedures. It could mean the child is put to sleep and a breathing tube is inserted, anything like that. But after we've done our piece, then there's another level of care that's necessary. And in a hospital like ours, which is a tertiary care children's hospital, that level of care needs to be pediatric intensive care, provided in a pediatric intensive care unit, and we need to have pediatric intensive care specialists to staff that unit. And we're very concerned, I'm very concerned, that our pediatric intensive care unit is in a very difficult position. We have 2 pediatric intensive care specialists in this province, and only 2, and we need more than that. And as you know, one of those physicians, Dr. Reid, has tendered a resignation. And where does that leave us as an emergency department? Where does that leave us as emergency physicians? Well, it leaves us contemplating the possibility that at some point in the future we may not have a pediatric intensive care unit, even on a temporary basis. And as a tertiary care children's hospital, that situation falls far below the expected standard of care. Losing our PICU would cripple the Janeway. Many services that take place now would not be able to occur. Some of these services are important but elective in nature. You can think of some major surgeries that couldn't go ahead. But in the emergency department, our patients, our kids, they show up unannounced, unscheduled, either by ambulance or, more often than not, if they're babies or small children, just through the waiting room. And we have to look after those patients. And without the services of a fully staffed pediatric intensive care unit, I personally am at a loss as to what we will do with some of those patients after we provide their emergency care. It's a very difficult situation, and I think it's a situation which is unacceptable, and I think whatever needs to happen to prevent that from occurring needs to happen, because it's certainly not something we're happy with, and it's not something the public will be happy with. Thank you.
Good afternoon, everybody. My name is Ian Marshall. I'm a graduate of Memorial University Faculty of Medicine, and I've been working at the Janeway for almost 20 years as a full-time emergency physician. And I've known Debbie Reid specifically. I don't want to reiterate everything that Bob just went through, and I completely agree with his statements. Specifically talking about Debbie Reid, Dr. Reid was an emergency physician with me at the Janeway, and she was one of the emergency physicians when I was a medical student, a clinical clerk, and an intern and resident with Memorial. She's done many, many years of invaluable service to the Janeway, and I think it's very important that we need to the government and the NLMA needs to focus on lifestyle of the physicians that are suffering and are not happy with the ongoing process. As Bob said, we do need an intensive care department. The majority of our patients we see at the Janeway are fairly straightforward and fairly easy to deal with. We can deal with the minor traumas and the orthopedic things, and most of it we can deal with. But a small percentage of our population that comes to us, they need urgent care, and it can't wait. We need physicians like Dr. Reid and Dr. Barter who are there, who've been there for quite some time. Most importantly in my mind, because they know a lot of these patients. A lot of the patients who come to the Janeway who are critically ill are chronic patients who have been coming back and forth to the Janeway for quite some time, and with one phone call we can phone Dr. Reid and she knows their complete history. In the past, they've tried to, there has been times when we've had locum physicians working, just would cover for 1 week or 2 weeks at a time, and that's great. I mean, it's fantastic to have people that will do that, but I don't think that's a long-term solution. What we need is a full complement for intensive care physicians at the Janeway to keep the hospital running as efficiently as it has been. That's about all I really have to say, because Bob summed it up very well. Thank you.
Well, Dr. Marshall, Dr. Porter, what do you think should happen here now? I mean, you sort of reiterated what we heard when Dr. Reid was here, surrounded by, I guess, many of her colleagues and many of your colleagues. But what does government need to do now to keep her here?
I think that the government needs to recognize that it's very important that this pediatric intensive care is stable. And I think they need to realize that part of the reason for this is the unfair payment system that exists. And, you know, there are two intensivists, and we know that we need more than two. And that's been the situation for a long, long time. And efforts have been made to recruit more people to work in the intensive care unit, and it's been unsuccessful. And that's been going on for a long, long time. And things are just getting worse. So I think, you know, the government needs to realize that one of the things that has to happen is that the payment to those people, you know, it has to be competitive with other places. And we need to be able to recruit people to fill our pediatric intensive care unit. So I think it's very important that things not sort of get worse over time.
You mentioned that some services simply won't be able to be done without pediatric ICU fully staffed. What kind of services are you talking about there, and would the alternative be that these kids have to be flown out to a place like, say, Halifax or Toronto? Well,
most patients that require intensive care treatment, from myself and Bob's perspective, are patients that have been intubated and are on a ventilator. And it's impossible to care for those patients in any other setting other than a critical care setting, which is either our department or an intensive care. And these aren't the type of patients that will be on a ventilator for a day and then off that. They're going to be there for a week or 2 weeks. So they basically need a full complement of fully running ICU. To have a tertiary care trauma referral center, which is what we are, we need a full ICU.
So what kind of conditions will we be talking about here where a patient, none of us are doctors,
no.
A patient would need to be intubated or on a ventilator for a week? Like, what kind of illnesses, what kind of injuries are we talking about here in general terms?
Well, there's a list. I could pull out a book and give you a whole list. But I mean, severe traumas, for one. Diabetic ketoacidosis, for 2. Seizure disorders, for 3. Bob, you want to add any more? Severe sepsis, I mean, which is an overwhelming infection. And I don't know what the numbers are, but a good percentage of the patients that are in intensive care are on life support systems, temporarily, but they are on life support. And if we don't have a full ICU, those patients, instead of phoning ICU, we will have to phone air ambulance to arrange transport to a different center.